Hello students, welcome to the next session of the pharmacology lecture discussion series. And in succession to the videos what I have been uploading on the local anesthetics, I have already discussed about the classification and the mechanism of action of local anesthetics. So this was a request from some students that I should discuss about the general anesthesia as well. So in succession to those videos, today's topic of my discussion will be mainly focusing upon the general anesthesia. So before getting into the detailed discussion about the stages of the general anesthesia, just a one-line definition, what I would like to discuss, what I would like to say, it is that the general anesthesia are the drugs which produce reversible loss of all sensations and consciousness. That is, it is a reversible loss of all sensations and consciousness. So after the general anesthesia has been given, so for a short duration of time, the sensations and the consciousness, the patient is going to retrieve back. So the cardinal features of any general anesthesia comprises of, particularly, there are four cardinal signs of general anesthesia. So the first cardinal sign, it is the loss of sensations, especially pain. So students, the first and foremost thing why the anesthesia is being given for any kind of a surgical treatment or any kind of a operations, whenever it needs to be carried out, it is mostly performed under general anesthesia. Why? Okay, just because it causes a loss of sensations, and particularly the sensation what is lost, it is of pain. So the first cardinal sign, it is the loss of the pain sensation. Moving on to the next cardinal sign of anesthesia, it is the sleep or the unconsciousness. So whenever any kind of a general anesthesia is being administered, the second cardinal sign, what is very clearly seen, it is the sleep or the unconsciousness. So the patient undergoes into a state of transient unconsciousness or in a sleeping mode. Moving on to the third cardinal sign, what is seen in cases of general anesthesia, it is the immobility and the muscle relaxation. So students, this I would like to emphasize, whenever any kind of a surgery is indicated, they are mostly performed under general anesthesia, and for the successful for that successful procedure, mostly that particular site needs to be immobilized as well. This immobilization is basically achieved by the muscle relaxation. So the another cardinal sign, the third cardinal sign, it is the immobility and the muscle relaxation what occurs after the general anesthesia administration. And fourth cardinal sign, it is the abolition of reflexes. So students, the four cardinal signs of general anesthesia, these were the four cardinal signs. And nowadays the term balanced anesthesia is being more commonly used, just because all these four cardinal signs are, whatever they are present, these cardinal signs, nowadays the term balanced anesthesia is being used just because these modalities what I have discussed in the cardinal signs are obtained by using the combination of drugs, and each drug is used for a specific purpose. So nowadays this general anesthesia is being given. There are variety of drugs such as pre-medications and certain other muscle relaxants and various other drug combinations are given. So nowadays the term the balanced anesthesia is being more widely used. So looking into the history to understand the stages of surgical anesthesia, I would like to emphasize that it was Guidel. When looking at the history of general anesthesia, it was Guidel. In 1920, he gave four sequential stages of general anesthesia. So, and the anesthetic agent, what Guidel used, the four stages what Guidel in 1920 gave, he was using ether as the anesthesia. The anesthetic agent, what Guidel used was, he used ether, and on the use of ether, the stages what he observed, he gave on that basis there are 4 stages of general anesthesia. So these things I would like to emphasize. So general anesthesia, they cause irregularly descending depression of the central nervous system. So what this line actually means, general anesthesia are going to cause an irregular depression of the CNS. So the CNS of our body, the CNS comprises of 2 things, that is the brain and the spinal cord. So these general anesthesia are going to cause a descending depression of the CNS, that is, the higher functions of the brain are lost first, and slowly and gradually the lower functions, the lower parts are affected. Whereas when looking at the spinal cord, in the spinal cord, it is the lower segments what are affected first, and later on the upper segments also. And when looking at the medulla, in case of the medulla, it is the centers of the medulla what are paralyzed. The medullary centers are paralyzed the last. All right. So at the last, the centers, the vital centers, what are located in the medulla oblongata, these centers are paralyzed the last with the depth of the local anesthesia. So as the depth of the inhalational or the general anesthesia deepens, the medullary paralysis also occurs. So these were the things, and nowadays Griddle has described these 4 stages on the basis of the ether anesthesia. But nowadays, these 4 sequential stages, what I'll be discussing, they are not as clearly demarcated just because of the newer technologies, the pre-medications, the muscle relaxants, and the different types of drugs what are given side by side along with the general anesthesia administration. So these were the facts what I would like to discuss. And before moving into the detailed discussion about these topics, I would like to say, I would like to discuss that beginning with the first stage. So the first stage what was given by Griddle, it was the stage of analgesia. So the first stage, what Griddle found, it was the stage of analgesia, and the word analgesia itself means there is no pain. This stage comprises of, first the stage what was seen, it was the stage of analgesia, and during the stage of analgesia, not only the pain sensation was abolished, but later on amnesia. In this stage, amnesia is also going to occur. So amnesia, you must have heard, students, that whenever any general anesthesia is being administered, there occurs for a short duration of time, the patient is unable to recall the events what were there. So once the patient enters into the operation theater and the general anesthesia is being administered, so after administration of the general anesthesia, when patient comes out of the OT after this successful operation, when we ask the patient as to what all events had taken place, he says he doesn't remember. So this kind of a temporary loss of memories for a short duration of time, when the patient is unable to recall the events for a shorter duration of time, this particular term, the term what is used for it, it is the amnesia. Amnesia actually refers to whenever there is going to occur a short-term loss of memory for a short duration of time. The patient is unable to recall what all things happened. So during the stage of analgesia, the striking distinguishing features what can be very well appreciated, that the patient is conscious and he is in the state of conversation. The surgeon or the physician, whosoever, the anesthesiologist who's there delivering the anesthesia, during the stage of analgesia, it is found that the patient is conscious and he is in the state of conversation as well. And this stage of analgesia starts from the beginning of the anesthesia inhalation and lasts up to the loss of consciousness. So this fact needs to be emphasized over here, that from the time the anesthesia is being administered to the time where the loss of consciousness is ultimately going to occur, the stage of analgesia persist, it is going this, and it is completely a painless state during this state, and the patient is conscious, patient can hear and see, and the patient is somewhat in a dream-like state. So this kind of a dream-like state occurs, and slowly and gradually what we find is that the patient is, the conversation is also slowing down. The patient enters into a state of a vivid, he enters into a state of dreaming. And the other features what are seen during the stage of analgesia, the reflexes and the respiration of the patient, these are normal. So during the stage of analgesia, it is not that major surgical operations, some minor surgical operations and some major operations still can be carried out, but short procedures can be carried out during the stage of analgesia. Moving on to the next stage, that is the stage of delirium. So delirium, the word delirium itself means that delirium, the literal meaning of the word delirium, it is that the patient is somewhat unaware of the surroundings. So it is occurring, it is a kind of a dream-like situation, and for a short duration of time, slowly and gradually, what happens is that the patient is slowly and gradually unaware, becoming unaware of the external surroundings. So the stage of delirium, it is marked by from the loss of consciousness to the beginning of regular respiration. This stage of delirium occurs, and the striking distinguishing fact, what needs to be emphasized about the second stage, that is the stage of delirium, it is that there is apparent excitement is seen. So nowadays, the stage of delirium has all cut down due to various pre-medications, various newer techniques have been used. So during the stage of delirium, the apparent excitement is seen. Patient may struggle, shout, and he can even hold his breath. The muscle tone is increases, the breathing is jerky, and in some cases, it has been found that there can occur vomiting as well. Involuntary micturition and defecation can occur. So in certain cases, there can occur micturition, that is the passage of urine, and defecation, involuntary passage of the urine, and the patient may defecate. So involuntary micturition and defecation may occur, as well as the heart rate and the blood pressure may rise. So these were the striking distinguishing features about the second stage, that is the stage of delirium, and during such a stage, no operative procedures are carried out. So it is advised that during the second stage, when there can occur apparent excitement, the patient may show signs of apparent excitement. So in that conditions, it is advised that no such stimulus and no such operative procedures needs to be carried out. Moving on to the third stage, before moving on to the third stage of surgical anesthesia, I would like to emphasize the fact that this stage of delirium, what I have discussed, that there is an apparent excitement of the patient is seen, the patient may shout, struggle, and even hold his breath. So these all things, these all features nowadays, it is entirely inconspicuous. That nowadays this stage of delirium, it is absolutely inconspicuous. It is not at all seen nowadays with the newer advancements in general anesthesia. In modern anesthesia, this stage of delirium is more or less entirely abolished. Moving on to the third stage, that is the stage of surgical anesthesia. So it starts, the stage of surgical anesthesia, that is the third stage, it extends from the onset of the regular respiration to the cessation of spontaneous breathing. So students, this is the stage what is going to extend from the onset of regular respiration to the cessation or the stoppage of the spontaneous breathing. And Guidel has described this stage of surgical anesthesia into 4 planes. So these all stages what I am discussing, these stages are still nowadays being used to assess the depth the light or the depth, the light, these stages are nowadays also they are used to assess whether the anesthesia is to the milder level, or the anesthesia it has penetrated to the much deeper level. So the third stage, Riddle has subclassified the third stage, that is the stage of surgical anesthesia, into 4 planes. That is the plane 1, in which the moving eyeballs are seen, the eyeballs are moving, and the first plane ends when the eyes become fixed. Moving on to the second plane, that is in the second plane what we find that there is loss of corneal and laryngeal reflexes. So students, the second stage was marked by the loss of corneal as well as the laryngeal reflexes are lost. Moving on to the third stage, that is the plane 3, the pupils start dilating, and ultimately the light reflex is also lost. And moving on to the fourth plane, that is the intercostal paralysis is going to occur. There is going to occur shallow abdominal respiration, and dilated pupils are seen. So the third stage of surgical anesthesia is further divided into 4 planes. And as anesthesia is going to pass to the deeper planes, what we find is the muscle tone is slowly and gradually going to decrease, the blood pressure falls, the heart rate increases, and respiration decreases in depth and later on in frequency also. And finally moving on to the fourth stage, that is the stage of medullary paralysis. Now this is the most severe stage, and if this state is reached, the patient may die. The fourth stage is the state of medullary paralysis, and this stage, the striking distinguishing fact, what I would like to emphasize over here, it is the cessation of breathing. The breathing is going to stop, and there is failure of circulation. And this will lead to death. So the fourth stage, it is mostly it is not said that the fourth stage should not be reached, because that will cause the cessation of breathing if the anesthesia has penetrated to such a level that it has affected the deeper centers of the medulla oblongata. So the medullary paralysis is going to occur, and the cessation that will lead to the cessation of breathing, because the vital centers for respiration and breathing is found in the medulla oblongata. So cessation of breathing will occur, and there will occur failure of circulation as well, and ultimately death. So in this condition, the pupils, they are widely dilated. So once this state of medullary paralysis is reached, now the patient is dead, and now medullary paralysis is reached, now the patient is dead. And now what is the classical finding, what can be very precise, it is the pupils, they are widely dilated, the muscles become they are widely dilated, the muscles become flabby, and the breathing, if it is there, the pulse becomes thready, or in some conditions it is imperceptible and the BP is very low. So students, these were the 4 stages what were described by Guidel in 1920, and these are the 4 sequential stages of general anesthesia. Nowadays, due to advancements in newer technologies, some stages, that is the second stage, that is the stage of delirium, this is not seen in the modern anesthesia practice. So this is not seen in the modern anesthesia practice. So this was a short discussion about the general anesthesia. And students, if you do have any questions, you are most welcome to comment me in the comment section. And students who are visiting from my channel for the first time, comment me in the comment section. And students who are visiting from my channel for the first time, if you haven't subscribed yet, please go do subscribe my channel. Thank you for watching.